As a young teenager, Catherine's severe period pain wasn't taken seriously by doctors, until a school camp and a shattered ankle brought things to a head.
I tripped and I shattered my ankle and I walked on it for the rest of the hike, returned to Melbourne and the doctor, and they were shocked that I was able to walk on it. And this is my regular GP, and I just said, well, it didn't hurt as much as my period did.
A diagnosis took more than a decade.
I was told I was perhaps a little bit hysterical, exaggerating the pain a tiny bit, and that, when I was older and I got pregnant, everything would be okay.
When she did decide surgery was the best option, she went 3 years without any news from the hospital.
I realised that if it just continued to get worse and I had to wait another 20 years for menopause or whatever, there's a chance I wasn't going to make it.
Even though Catherine did eventually have an initial appointment with the Canberra Endometriosis Center, she was warned it could be another year before she might be able to have surgery. She decided it was time to go private, despite the financial burden that would carry. Canberra Health Services can't say with certainty how many people are on the waiting list for endometriosis surgery because it doesn't collect that data. But earlier this year, there were more than 2,000 people waiting for an appointment with the Canberra Endometriosis Centre and 700 waiting for gynecological surgery. Like Catherine, Chantel turned to surgery when endometriosis pain began affecting her work and relationships.
You can't, it is debilitating. Heat wasn't helping, like a heat pack or a water bottle. It got to the point that I was burning myself because I needed it so hot to even try and reduce the pain.
But after a year with no news and feeling ignored and let down by the system, Chantel also gave up and went private.
A laparoscopy is not just a one-off. You can have it, you may need it multiple times. I'm not going to be able to afford it to go back through private multiple times.
A recently established pelvic pain clinic in Canberra is helping bridge the gap while patients wait years for appointments at the Endo Center.
Lots of patients in this space often have felt fairly dismissed and have often been under-recognised and under-managed.
Patients can currently get in for an appointment within a few weeks, but demand is already steadily increasing. Lottie, Twyford, ABC News, Canberra.